At Complete Physio, we are able to refer patients for an MRI scan. There are a number of reasons why patients might require an MRI scan. For example, if someone's had an injury to their knee, it's become very suddenly swollen, they're having difficulty mobilizing. We may recommend that you go for an MRI scan to check to see, for example, if you've ruptured your ACL, anterior cruciate ligament, or if you've torn a meniscus. And oftentimes it will be either a prerequisite for surgery, so it's assessing whether or not the patient actually requires surgery, or indeed if their injury is going to be able to be managed conservatively through physiotherapy and exercise and rehabilitation. When you see your physiotherapist, they will assess your joint, your problem, whether it's a shoulder or a knee or a back problem, and they can talk to you about whether or not they feel any further investigations or imaging is required. And by imaging, they might talk to you about, for example, an X-ray. An X-ray looks at bones. It can be used to assess, obviously, for a fracture or a broken bone. That's the most common reason that most people would be aware of. But an X-ray can also be very useful for assessing the degree of degenerative change, for example, in a knee or a hip. So if a patient's experiencing a lot of pain in this area, very occasionally we will also recommend an MRI scan for back pain. When we're recommending an MR for back pain, it's oftentimes because the patient is experiencing neurological symptoms. This can be numbness or weakness or a change in their reflexes. And an MRI scan here can be really important to rule out any serious pathology and also, again, to assess whether or not any sort of surgical intervention might be required or even an injection be required to reduce their pain symptoms. All of the clinicians at Complete Physio are highly trained in referring for different types of imaging, and they will talk to you about any requirements or any recommendations that they have with regards to referring you on. We can access imaging either privately, they can make a direct referral for private imaging, or they can write a letter to your GP if you would prefer to access imaging via the NHS. This can be discussed with your physio on the day.